My name is Nicole Nifo. I'm a registered massage therapist, and some of my special focus with practice is with pregnancy, the perinatal care through pregnancy, as a labor doula as well, and then in postpartum, and then I also work with babies and small children as well. We get a lot of calls with parents whose babies aren't sleeping, who are, have constipation or who have gas, and others who just maybe are lacking in that initial connection with their child and the bonding of what massage can do. So they'll call us, and then we'll sit down and talk to them in person and instruct them on how to massage their child. As massage therapists, we do the hands-on with the baby, and then the parents try. We're gonna be showing some techniques for baby massage. You definitely wanna use an oil that is okay for them to ingest, because they're probably gonna either suck on the bottle or their hands or feet. Generally, we wanna keep the diaper on, so I usually undress the baby. Unless it's a cold day, then I'll keep a blanket over half their body. So we do need to make sure our nails are short and that we have all of our rings taken off. We put a couple of drops of our oil, and we wanna ask for permission. So we do this and like this. Okay, can we do a massage? Can we do a massage? And so what we do teach parents is that you want to make sure your baby's in a quiet, alert stage, and your baby does seem very quiet right now, and he's definitely alert. So massage can be done in various positions as well. We want to be flexible with how we're doing massage to our children. We don't want to force them to be always laying down as well. So again, we just spread the oil on, and you can go on either side of your baby's spine, helping to stimulate the paraspinals in there. Okay. And we can also do our crisscrossing as well. Yeah. And we can do a bit of C-scooping for the neck. Some babies are very sensitive, new babies, with neck treatment as well, just because of maybe the way they were born. So definitely teach the parents to be cautious of that. And massage is generally just really good for growth and development. It teaches the parents a tool that they can use to help aid in growth and development of their child. And then also too, we teach leg pumping techniques, which a lot of parents have already YouTubed before I even get to them. But we're gonna grab under the knees, and we're gonna apply a bit of pressure into the abdomen. So we're gonna come here and then release. So if the baby does push against you, I usually suggest that they just rock the baby's lower back. See how everything just loosens up again? And then you get in there and you push, and then you release again. So I definitely think it's important that the therapist receives some extra training of some kind in the perinatal. I became a labor doula because I wanted to understand what it was that a woman's body goes through, because at the time I had not had children. Now having a child, I understand. So taking extra courses like a labor doula, postpartum doula as well, because they teach you about how to take care of babies. So something that, as a massage therapist who's visiting a new mom, if you have some tips you can give them on new baby care, why not? Help them and support them in that way. The pregnancy training, the infant massage training, the pediatric massage training, these are all extra courses that a therapist can seek out outside of school to let the general public know, hey, this is what I do, I'm certified in this, or I've taken extra courses in this, because generally the public wants to know that there is some sort of extra training. There's a couple of different courses out there for therapists to take. I myself want to come up with my own course because I don't feel like there's enough variety. And I believe that, there needs to be different ways of communicating the course to people as well. I think not everybody can travel, across the country or across the province to take a course. Like Canadian-wise, I don't feel like there's a lot of online resources enough available to registered massage therapists. And I'm hoping that over time, just this general training in the schools will allow them to at least have a good base. I know that when I graduated, there was very little, but now schools are starting to actually incorporate more information and education on working with infants and working with pregnant women, which makes sense, because a practitioner who's had a business for 10 years maybe has seen a patient since they were 15 and now they're 25 and they're starting to have kids. You don't necessarily want that patient to have to go somewhere else. You want to at least have an understanding, because they don't want to go anywhere else either. They're most comfortable with you. So to have at least an understanding of what you're doing with them while they're pregnant, I think is just important, whether you want to specialize or not.